Here are 5 evidence-informed exercises that are safe, practical, and beneficial for most people during pregnancy and after giving birth, plus how to do them and how to adapt as your body changes. Always check with your obstetric provider first, especially if you have medical complications, and stop if anything feels off: dizziness, chest pain, vaginal bleeding, fluid leakage, contractions that don't settle, marked shortness of breath, or calf pain, swelling. 360-degree diaphragmatic breathing with pelvic floor coordination. Why it matters. This is the foundation for core and pelvic floor function. It helps manage pressure in your abdomen, supports your back, and prepares you for labor. Postpartum, it's the first step in reconnecting your deep core and can reduce the risk of leaking or doming. How? Sit or lie on your side or an incline. One hand on ribs, one on lower belly. Inhale through your nose and let your ribs expand in all directions, front, sides, back, while your pelvic floor gently lengthens. Exhale through pursed lips. Let the ribs glide down and in as you lightly lift and close the pelvic floor and draw the lower belly in. Think blow before you go. During pregnancy, prioritize the full inhale and the ability to relax. Lengthen the pelvic floor, especially in the 3rd trimester. Use side-lying or seated positions if lying flat feels uncomfortable. Postpartum, begin with gentle breaths once your provider okays activity. Rebuild the exhale to exert pattern before adding load or impact. If you feel heaviness or leaking, reduce intensity and return to breath coordination. Dose 5 to 10 slow breaths, 2 to 3 times per day. Integrate the exhale on effort cue into all other exercises and daily tasks. Low-impact cardio walking, swimming, or stationary cycling. Why it matters. Supports heart health, mood, energy, and circulation. Helps manage weight and blood sugar. Can decrease back and pelvic discomfort. Water provides gentle support for joints late in pregnancy. Intensity. Aim for moderate. Ever able to talk in full sentences but not sing IREP 4 minutos entre 10. ACOG suggests about 150 minutes per week if you are active pre-pregnancy. Start lower and build gradually if you're new to exercise. During pregnancy, choose flat terrain or an incline you can manage without breath holding. Keep cool, hydrate, and wear supportive footwear. Swimming or the elliptical can be great if walking triggers pelvic or pubic discomfort. Postpartum, start with short bouts, 5 to 10 minutes, and increase by 5 minutes as tolerated. If you notice pelvic heaviness, pressure, or leaking, scale back intensity, duration, and consult a pelvic floor physical therapist. Dose: 20 to 40 minutes, 3 to 5 days, week, adjusted to how you feel. Squats, sit to stand or goblet squat. Why it matters. Builds glute, quad, and core strength for daily tasks like picking up your baby, getting out of a chair, and reducing back strain. Squats also teach the pelvic floor to lengthen on the way down and gently recoil on the way up. How? Stand feet hip to shoulder width. Inhale to prepare. Sit your hips back as if to a chair. Keep ribs stacked over pelvis, knees tracking over toes. Exhale as you stand, connecting ribs, deep core, and pelvic floor. Blow before you go. Modifications. Use a box or chair for a target. Widen your stance slightly in late pregnancy. Elevate heels if ankles are stiff. Or hold a light weight close to the chest for counterbalance. If you feel pubic symphysis pain, keep your stance symmetrical and reduce depth. Postpartum progression. Start with body weights, sit to stands. Then add light load, for example, a dumbbell goblet squat. As your symptoms and energy allow. Watch for abdominal doming. If it shows up, reduce depth or load and tighten up your exhale. Dose: 2 to 3 sets of 6 to 12 reps, 2 to 3 days week with a rest day between. Band or cable row horizontal pull. Why it matters. Counters the rounded shoulder posture of pregnancy and newborn care, supports the upper back, and helps with comfortable baby holding and feeding positions. How? Anchor a band at chest height. Stand tall, soft knees, ribs stacked over pelvis. Inhale to prepare. On the exhale, draw the band toward your ribcage, feeling shoulder blades glide back and down without flaring the ribs. Control the return on an inhale. Keep neck relaxed. Modifications. Perform seated if balance is an issue, or half kneeling to reduce back sway. Use light to moderate resistance. Your form and breath control matter more than the load. Postpartum, start with a very light band and higher reps to re-educate posture. Progress resistance as tolerated while maintaining the exhale on the pull. Dose: 2 to 3 sets of 8 to 15 reps, 2 to 3 days week. Quadruped core series, cat, cow, and bird. Dog, why it matters. On all fours positions, unload the pelvis and back. Improve spinal mobility and build deep core stability without straining the abdominal wall. Cat-cow mobility. Hands under shoulders, knees under hips. Inhale as your chest lifts and tailbone tips up gently. Exhale as you round your spine and connect ribs to pelvis. Move slowly through a comfortable range. Bird dog stability. From neutral spine, exhale to extend one leg back and the opposite arm forward without shifting the torso. Inhale to return. Keep your belly from doming and your pelvis steady. Smaller ranges are fine. Modifications. Widen knees, elevate hands on a bench if wrists are sensitive, or do just legs or just arms if balance is tricky. Late in pregnancy, a smaller range or more rest between reps may feel best. Postpartum progression. Start with cat-cow and short lever bird-dog. Tap toes, reach thumb, and lengthen as control improves. If you notice doming, coning, or back discomfort, shorten the range and firm up the exhale. Dose, cat-cow, 5 to 8 slow cycles. Bird-dog, 6 to 10 reps per side, 1 to 2 sets, 3 to 5 days week. Safety and smart training tips. Clearance and timing. Get your provider's okay. Many can begin or continue gentle movement throughout pregnancy and restart gradually postpartum once cleared. Timelines vary, especially after cesarean or complicated births. Positioning. After mid-pregnancy, avoid lying flat on your back for long periods. Use side lying or an incline. Side lying is also great for core and pelvic floor work. Breath and pressure. Exhale on effort. Avoid breath holding, no Valsalva. If you see abdominal doming or feel pelvic pressure, reduce the load range or modify the exercise. Temperature and hydration. Avoid overheating. Drink water before, during, and after. Dress in layers. What to avoid? Contact sports, activities with a high risk of falling, scuba diving, and very hot environments. Adjust running. Plyometrics if you experience leaking, heaviness, or pain. Red flags, stop and seek care. Vaginal bleeding, fluid leakage, painful contractions, chest pain, dizziness, fainting, shortness of breath at rest, calf pain, swelling, severe headache, or decreased fetal movement. Simple weekly template. Adapt to your energy and schedule. Most days, 5 to 10 minutes of 360 breathing and gentle mobility. 3 to 5 days. Low impact cardio, walk, swim, cycle. At conversational pace. 2 to 3 days non-consecutive strength session pairing squats and rows with bird dog. Example, a day squat plus row plus bird dog. B-day, hip hinge for example, light RDL or sit to stand focus, plus row plus cat-cow and side-lying clamshells if hips need extra support. Daily life, use exhale on effort when you lift, stand up, carry your baby or push a stroller. When to get extra support. If you have pelvic pain, pubic symphysis pain, leaking, heaviness, prolapse symptoms, or lingering abdominal doming, a pelvic floor physical therapist can tailor modifications and progressions to you. If you're managing conditions like placenta previa after mid-pregnancy, preeclampsia, severe anemia, or significant heart-lung issues, get specific guidance before exercising. With these 5 pillars: breath and pelvic floor coordination, low-impact cardio, squats, rows, and quadruped core work, you'll cover strength, stability, posture, and endurance in ways that support you through pregnancy and help you rebuild confidently after birth. If you'd like, tell me your current trimester, fitness level, any aches, pains, and what equipment you have, and I'll sketch a customized routine.